This person says, I'm taking antidepressants for PMDD, which is premenstrual dysphoric disorder. Is it possible that my PMDD symptoms will subside? Well, first of all, what's PMDD? PMDD, or premenstrual dysphoric disorder, is like a really severe form of PMS, or premenstrual syndrome. So premenstrual syndrome is essentially as after ovulation, as the estrogen starts to fall and the progesterone from the corpus luteum starts to climb, there are some symptoms in that sort of week prior to the menstrual cycle that are hormonally mediated and can contribute to some pretty significant symptoms for people, such as mood, such as a low mood or depression or feeling teary or crying spontaneously. It can also contribute to craving carbohydrates, or changes in physiology or changes in metabolism can lead to insomnia or really having trouble sleeping. And the PMS symptoms tend to get a little worse as people get older toward perimenopause as well. But I know this person is talking specifically about a cycling PMDD or PMS. So PMDD is a severe form of PMS, and it impacts approximately 1 to 2% of women. And so PMS is prevalent. I think most women have experienced some form of that alteration that happens before the menstrual cycle, but PMDD is quite severe, and it has a constellation of symptoms that are really incapacitating. So mood disorders, specifically depression, anxiety, incapacitating anxiety, insomnia, which creates a vicious cycle around all those other mood-related symptoms. And so this person is taking antidepressants for PMDD, and it is hopeful and likely that antidepressants, if they're, for example, SSRIs or selective serotonin reuptake inhibitors, or SNRIs, selective norepinephrine reuptake inhibitors, all of these sort of newer versions of depression medication and anti-anxiety medication, it is presumed that those will help definitely with the mood instability related to PMDD. I will say, however, that because it's a hormone cause, I generally suggest that patients use a hormone treatment to stabilize their hormones, because the PMDD cycles and causes trouble around the time of the cycle. And if we can inhibit ovulation and we can stabilize hormones, then very often the PMS and the PMDD will get a lot better because the cycle isn't occurring. So there are several ways to do ovulation inhibition, and a birth control pill is the most common. There are actually a couple birth control pills using drospirenone as a progesterone on the market, which also are on label for PMDD. So they're known to help with premenstrual dysphoric disorder. Other birth control pills will help as well because of that ovulation inhibition and stabilizing the hormones. And there are other ways like Depo-Provera. Now, Depo-Provera has some mood side effects, but it's an injection that you get every 3 months. It's a progesterone, and because it inhibits ovulation and it helps stabilize hormones, sometimes it will help with hormone fluctuations, PMS and PMDD. There are other more aggressive ways to shut down the menstrual cycle that may help with PMDD in really incapacitating situations. But starting with a hormone stabilization or a birth control pill, specifically one with drospirenone, is probably what I would consider first line. But the answer to this person's question, will the antidepressants work? They really should. And I would say if they're not working, it's time to go back for reassessment.